Professor Jacques, Ejaz Akram here, and welcome to our special conversation today on the global assessment of COVID-19. How are you today?
I'm ready to go.
Excellent, very good. As you know, Professor Jacques, that COVID-19 was a big challenge for societies all over the world, economically speaking, socially speaking, and certainly had lots of political challenges as well. And it seems that the specter of COVID 3 years later would not go away. And so it seems like this is something that we have to deal with. And we have in front of us various experience of different countries. We have China, we have European countries, other developed countries in Asia, we have the United States of America, Canada, and so forth. And then you have, a lot of these other smaller countries in Africa and Latin America and South Asia and so forth, which are sort of always trying to look at the more developed countries and see how their responses were. And one of the things that I noticed that the United States of America, particularly, myself being a Pakistani-American scholar of world politics, have spent a couple of decades in that country, and I could not help but think that what went wrong, and as you have, being British, and also have spent considerable amount of time in China and authored these wonderful books on getting the Western audiences to understand China better. And one of my favorites is When China Rules the World. I think that's what led me to you initially, and then I had that meeting with you in Malaysia, I remember. So you understand both of the worlds very well. And so my first two questions to you, how would you evaluate China's early response to COVID-19 compared to many other countries? And why did the West seem so ill-prepared for COVID-19?
Well, I think that, first of all, we're not out of COVID, so it's still a major issue for us across the world. That's one remark I'd like to make. And the second general point I would say is I agree with you that the pandemic was unprecedented challenge for all societies and governments. There'd really been not much preparation, a bit in China and East Asia because of the experience earlier of such a virus. But basically, it was an entirely new experience for the world, and an extraordinary test of the capacity of both society and government to deal with this kind of challenge. Now, China's relationship with COVID was unique in that it first appeared in China. And so China had to deal with it on the front line, unable to draw on the experience of other countries because there had been no experience of it.
That's right.
And I think that's always got to be borne in mind in terms of evaluating China's initial response. Now, that said, probably initially, I mean, it's inevitable, there'll be missteps in a situation like that. I mean, a patient appears at a hospital or in front of a doctor, and what have they got? And so I think that the initial response in China was probably rather slow and trying to work out, what it was, and the Western attitude towards China's response was really sort of a Cold War response, which
That's
was
right.
immediately to condemn China for its slowness and its cover-up, secrecy, and so on, God knows what. During January, that absolutely dominated the Western response to COVID. In fact, it was all the West was interested in. It was interested in condemning China. It wasn't interested in understanding what was happening in China. And it was to pay the West was to pay a huge price for this toxic political attitude towards China. So I think that the Chinese response gathered momentum during the period of January. It's on January the 11th, if I recall correctly, it circulated the genome sequence across the world so that people could understand what the nature of the structure of COVID-19 was. By the 20th, 21st of January, China was absolutely clear what had to be done, which was the epicenter of the epidemic was in Wuhan and Hubei province, and went for a strategy of lockdown. And it seems to me from that moment, China's response was extraordinary and an example to the rest of the world. But the problem is the rest of the world wasn't taking China's response seriously.
That's right. It's quite interesting because I was there when the outbreak happened in January 2020, and I was actually in the city of Chongqing, which was a little bit away from Wuhan. But since I had finished my term, I tried to book an early flight and tried to, scared because of the hype created by the Western media. Since I don't speak Chinese, so I was not watching the Chinese media, but I was watching the Western media by having access through the YouTube and so forth. And so I got out of there, and I was greatly worried because I thought that if there is going to be a outbreak at the global level, that at least the further away from the epicenter I am, the better off I will be. But lo and behold, very soon we saw that Chinese started building hospitals and quarantine centers in days, and by the time the outbreak had reached the West, and according to many estimates that existed actually before that, it seems like the West was really ill prepared to take the necessary steps to prevent its people from being infected. Now, so my second question is that why was the West so ill prepared, particularly the United States of America? I've spent a lot of time, a couple of decades in that country, and I used to be still am, admirer of wonderful people that live in America, hardworking, honest people, but as far as their governance is concerned, their governments are concerned, I feel that they have let them down, because one of the highest outbreaks, actually, I have some figures here in front of me. The CNN reported that, Center for Disease Control, CDC, said that 17 states, including Washington and New York, experience a very high level of severe outbreaks of respiratory diseases, flu cases, hospitalization, and so many deaths. 1.6 million people have fallen ill, 13,000 hospitalized, and 730 dead. So is this the same Western world that you and I know about?
Well, I think that what one would say is that the West was not just ill-prepared, was totally unprepared for COVID-19. I mean, it just believed that what had happened in China could never spread to the West. In other words, the Western mentality was insular and provincial. And this belonged to a much earlier era of sort of nationalistic and Western-centric thinking. And I think it also had a racist dimension to it. What the Chinese can suffer from, we won't suffer from. It won't visit us, even though, by the way, there was already evidence across other East Asian countries like Japan and South Korea and Thailand and so on of the spread outside China. And the second problem in the Western attitude was this Cold War attitude towards China. China is evil, China is backward, China is regressive. And so they thought they absolutely had nothing to learn from China. They didn't need to bother with it. They just felt. So it was as if they lived, there was an Iron Curtain, and the Iron Curtain was round the West, protecting it from the virus. Of course, it never worked. So you had a situation in, in my own country where there's a sort of SAGE security committee which discusses these kind of questions at the highest governmental level, and the prime minister, didn't attend any of the, I think, first 6 meetings. He never attended any of them, including the discussions on COVID. And this was typical of the mentality in the West. So when it spread to the West, I mean, I think January 31st, first case in Britain, around the same time in the United States, and so on, totally unprepared for the situation. And it wasn't until later in February, when it spread to 6 towns near Milan in Italy, that suddenly the West began to wake up and thought, goodness me, it's here. And it was, and it was absolutely no plans at all to deal with the situation. So that in February and March, finally the West, in panic. Britain, for example, and other countries, Italy already, went for a lockdown. I mean, they'd said we'd never do a lockdown like the Chinese have done. This would be completely inappropriate in a European country, and so on. But on the contrary, they did a copy and paste job in terms of the lockdown. So I think this, is an extraordinary reflection on the failure of the West it hasn't taken on board the rise of China, the transformation of China, that China is an integral part of the world, and it needs to learn from China. Watch what's happening in China and proceed accordingly. So this was a huge failure. I think, one of the great historic failures of the West. It was not to understand what was happening in China, draw the necessary conclusions, dialogue with the Chinese experts and so on, the medical experts and so on.
Yes, I think, going back again, when I listen to you, my mind goes back to your book when I was reading that the West has this fundamental inability to learn from other people's experience, because primarily it is due to its hubris that there's nothing we can learn from the non-Western countries. And I think this is an attitude that you have often pointed towards. And I think that there are many people, many sane voices inside the West who have actually begun to realize what you have been saying since many years. 3 factors come to my mind. First one is a failure of political leadership, as you have often mentioned. Second is the incompetence of the government system. And third is that underlying political culture. I was reading the other day, I was dusting my library, and I came across that famous book by Alan Bloom, written in 1980s, The Closing of the American Mind. And, back then, as graduate students, when I used to read such works in America, on America, they made some sense, but again, there was too much faith in the American ability to actually autocorrect and self-correct itself, that it would continue to be the shining city on the hill. But as I read the other day, I was dusting my books and I came across the same volume and browsed through it, and there you go, Alan Bloom, his argument that it is that primarily the intellectual challenges that underlie the political culture of America that somehow leads to this incompetence of governance and the failure of the political leadership. I was wondering what you would say to that.
Oh, well, I share a lot of what you've been saying, and it was displayed in a dramatic, almost theatrical, bordering on farcical way in the United States during the course of February, March, and April. I mean, you had a president who just didn't think it was relevant. It didn't need to do anything special. It didn't need public health measures. It didn't need testing. It didn't need testing kits. It didn't need to isolate cases. It didn't need to trace contacts. It didn't need PPE. There'll be some magic potion which he would, America would find and solve the problem. I mean, it was really going back on so much of what America has been able to do with a scientific and technological mentality. It was the most extraordinary phenomenon. And so I think that basically America's response to the pandemic was catastrophic. I mean, to have 1 million, I don't know what the latest death figures are. I think it's about 1,050,000, something like that. I mean, right. That is a catastrophic. When you compare that with China, which has got something like the latest figures about 5,230, something like that dead. I mean, right. China's got 4 times the population of the United States. China's a developing country. America's a developed country. But in their responses, you'd think America was the developing country and China was the developed country, because its whole attitude towards fighting the pandemic was on a completely different order. The Chinese approach, an all government, all society mobilization to deal with it. It was given this central priority over all else. This never happened in the United States. The United States did the opposite. The prioritization in the United States was the economy. So therefore, they never went for any kind of lockdowns, but beyond a very, very limited way. And it paid an enormous price for this in terms of the colossal number of infections and over 1 million dead.
Right. Why the West never acknowledged China's success in fighting COVID-19, or for that matter, other countries. My own country of residence now, which is Pakistan, my native, with a early importation of vaccines, and again thanks to China, because they had given at a very low cost vaccines to Pakistan. At least the forces and the state officials got inoculated very earlier on. But through a sensible policy of smart lockdowns, actually relatively poor developing countries such as Pakistan actually fared quite well. And it's altogether another matter that my current prime minister right now is in COVID lockdown. As soon as he went to UK, he got COVID, and so he's actually in the middle of lockdown over there. But the previous government, Imran Khan government, which was actually at the helm of affairs when the COVID outbreak happened, performed rather well. And so I was thinking that even if we compared experience of this country with that of the United States, it just I cannot help but think what's beneath this cowboy mentality, that we know that we are on the right path, therefore everybody else must be wrong. And so what's at the bottom of this attitude, in your opinion?
Well, I suppose it's probably quite a deep phenomenon, really, with a number of different kinds of things happening. I mean, the first problem is that America, in many respects, has a quite insular mentality, especially for a country which has such large global interests and global commitments. But there's a huge gap between the way America seems, I think, to the outside world, and, for example, the nature of American politics and a lot of attitudes, as we saw during the pandemic. I mean, it became a partisan issue. A lot of Republicans dismissed it as a sort of a, either not so significant or a Chinese plot. You had Trump saying, Kung flu and the China virus and all this kind of thing. So the reaction was really primitive and uneducated. I mean, I was very struck by the difference between the Chinese response and the American response. The Chinese response, Xi Jinping, the party leadership, government leadership, their reaction was immediately to consult the experts and basically put the experts in charge of the fight against the pandemic. This never happened in America. I mean, Trump, got his son-in-law involved and his daughter and people who knew next to nothing about it. And Fauci, who
right. Praetorian politics,
was often ridiculed by Trump. So there you had the most developed country in the world with the most backward kind of responses, intellectually and medically to the problem. And so you can see, I mean, I think that what you say about the United States, and it is often said in the context of the health system, is that it's both a peculiar mixture of the most developed country in the world with very powerful features of a third world country alongside it. For example, exemplified by the huge inequalities in the society. And we always got to remember the attitude towards life in the United States is, I think, very different from China. China has a very inclusive attitude towards life. It values life. Why did China pursue the strategy it did? Because it has an extraordinary emphasis on the importance of life, much more than the West. This sounds very odd, I think, to probably to many to say this. I mean, the fact is, are people aware of the fact that this last year or so, China's expectation of life is now greater than that of the United States? It's past the United States, even though it's got something like a third or less than a third of the living standards of the United States. Now, how do you explain that? Because it's still, in many ways, large areas, are pretty backward by Western standards. So China accorded enormous significance to the importance of life. And so there's an inclusivity about China's attitude towards its population, which does not exist in the United States. The United States is a much more divided society, not least on ethnic grounds. So how do you explain the attitude, in particular, obviously, towards blacks, or towards, historically, towards the native population, the Native Americans? So unfortunately, you've got a society, where is in some respects definitely the most advanced society and economy in the world, living cheek by jowl with poverty, deprivation, incarceration, and the black population.
That's right. Very, very, very.
You got to see. I think America's got to be seen in these kind of terms. That is it advanced or is it backward? Well, it's both, actually.
It's actually simultaneously both, and this is very interesting for me because the further I have stayed away outside of the U.S., especially going into East Asian countries, I have also noticed the same thing. One of the things that I was thinking, that on one hand you have this very rather poor response towards the COVID-19 management of the American, inside America, but also the global commons, because it's a global problem, so there have to be global solutions. So some kind of global governance consensus must be developed on these things, for which China is always ever ready, but the United States seems to be dragging its feet. But on the second thing, so there are two aspects to this COVID problem. One is the political that we have discussed. Second is there is also then epidemiological level. We see that because of the types of vaccines they have used, has led to a greater level of vaccine injuries. And so there is a much staggering number of extra deaths that are happening in many Western countries, particularly the United States of America. That on one side, and then you have companies such as Pfizer that have reaped 1,000% profits on their vaccines. A vaccine that cost $1.38 to manufacture is being sold for $130. You have a 10,000% profit margin. And so it seems like while people were dying, these companies were making a killing, economically speaking. So the next question would be that if that being in the background, the West has chosen to live with COVID-19, as Joe Biden has said that this COVID-19 seems to have gone away because you see nobody's wearing masks. That is not an indicator that COVID-19 has gone away, but China has still pursued a zero tolerance policy. So what does it mean to you, and where's the difference?
I think that the reality is that the West, with the exception of New Zealand, comprehensively failed in tackling COVID on the basis of public health measures. In other words, contact testing and so on. It was unable to deal with it. The figures in the United States went constantly up. In Europe, it went in waves. When it got more serious, Europe introduced more stringent measures and so on. But in both cases, Europe and the United States, they never got on top of COVID-19 until the vaccines, which came in the end of 2020, early 2021, began to spread. And that saved the West in terms of the number of deaths. It didn't save the West in terms of the number of cases, the number of infections, because the vaccines did not control infection rates. So they were huge, and they carried on being huge, and they are still very, very high. In China, on the contrary, China basically sought to minimize the number of cases. It wasn't just the deaths being only 5,200 odd. It was also a much lower level of infections. I mean, when they lock down now in China, the number of cases involved are very, very small. At the most tens of thousands, but usually something way, way below that. So basically, the Chinese approach was an intolerance of COVID-19, and the West was, we're going to live with it. Now, the cost of living with it is still really to be calculated, because COVID is a very nasty illness, which which in all cases, in some degree or other, attacks other organs of the body. Now, sometimes that's very mild. I mean, I had COVID-19 for the first time last June, and because I was hospitalized because I had got pneumonia as a result of it. They found in the hospital a clot on my left lung. If I'd never been in hospital, they'd never have found the clot, and they couldn't have dealt with it. Now, and if you look at the figures, employment figures in the West now, you'll see that one of the big problems in the economic circumstances we've got at the moment is a shortage of labor. What is that about? I think it's got a great deal to do with just the sheer impact of a very large number of COVID cases, and they still continue to be large. But the West is pretending, actually, really, that it's over, and the governments are pretending it's over. So if you take my own country, I mean, they've stopped testing, they've stopped supplying statistics and so on. It's only monthly statistics now, and so we've decided in the Western mind, well, that COVID was yesterday. Actually, it's not yesterday. It still continues to be a big problem. So China's, I don't think China could sustain its present level of controls economically, and because it's having a very difficult effect. And there is some kind of balancing that has to go on in relation to these kind of calculations. But the Chinese approach is still informed by the fact that it has to look after the health of the people and minimize the number of infections and not just the number of deaths.
Great. Now, my one final questions, and then if you have a couple of minutes response to this, and then we can wrap up this lovely discussion I had with you. Looking back at the pandemic, I mean, you have answered you made some remarks earlier. How do you see its significance in larger historical terms over, decades of, in terms of economy, transformations in society, and so forth? What is your long-term view, historical view about the pandemic?
Well, I think it's been something of an historic turning point, because China did so much better than the United States and the West. And although the West has never acknowledged this, of course, those who know the situation. So basically, the Western response has been diversionary, never to draw attention to China. Quick, put the statistics, under back in the drawer so that no one can see them. I mean, it's extraordinary. But basically, this pandemic showed the superiority of Chinese governance over Western governance in response to a pandemic of this scale. And that's, I think, that's a very important development, because until this point, basically, there was a kind of acceptance in the West that Chinese governance had been very effective in the economic sphere. I mean, of course, they didn't accept that for a long time, but then they grudgingly did accept that, and they sort of, in some degree, had taken that on board. But this was different. This was a much wider and far-reaching notion of governance, the ability to control this kind of pandemic. And so it seems to me that the whole debate about governance, China versus the West in this context, has shifted as a result of COVID-19. This is an historic moment where Chinese governance now has to be considered as a really serious competitor, all-round competitor to the way Western government has been handled. Second thing, I think, is it raises it's got to raise in the mind, though not yet in the Western mind, alas, that the way in which Confucian-based societies, notably China, but also South Korea and Taiwan and Vietnam and so on, Japan, they have that their social norms are very different from those in the West. The West is based on individualism, and these societies are based first and foremost on the cohesiveness, the strength of society, of the exercise of social responsibility. And it was possible to fight. All the East Asian countries share with China low levels of deaths, low levels of infections. It varies, but they still are in marked contrast to what happened in the West. Why? It's not just about governments. It's about social attitudes. It's about, the individual is not defined as extant from society. The individual is defined as part of society. And this is a very big difference between East Asian societies and Western societies. And I think those two things are going to be lasting consequences of the pandemic. And my final point would be that this was a most extraordinary event. It stands, I think, as the most important event in the life of the world since the end of the Second World War. And I don't think anything can be quite the same again, in not just at a political level, but just in terms of the perception of everyone of what life, of what one can assume and not assume in life. And so it's going to have a far-reaching impact, I think, on the psychology of society. We've never had a crisis like that since 1945, where the whole of the world was embraced, at a macro level down to the level of the individual.
Right. This has been a fabulous discussion, and even though it seems like we're discussing something of medical significance, but the transformation that this pandemic has brought about has been so profound that we already feel that it has touched every aspect of our lives. And so we can, hope that in the future, all societies will learn from each other and give up some of this hubris and arrogance that has been marked some of the Western political elites, because many people in the United States are well-meaning, hardworking people who would like to have a good life and learn from China. As the Chinese firms are already building bridges, hospitals, stadiums, and so forth in the United States of America. There should be no shame associated with it, but it's rather a matter of pride that societies help each other. Professor Jacques, it was very lovely to see you again as always, and I look forward to many more conversations with you in future.
Great. Thank you very much. It's been a really good opportunity to discuss such an important question, and the very best to you. Thank you.
Thank you. Bye-bye.
Bye-bye.